This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program. I'm Dave Wilson. This is Mon Health Talk. Our guest this morning, Dr. Gabrielle Sakellarides, Mon Health Primary Care, and we'll be talking about, obviously, primary care. Dr. Sakellarides, good morning. How are you?
Good. How are you doing?
I'm doing great. Before we jump into the topic, you've been one of our guests before, but go ahead and talk a little bit about your background, where you came from, your education, how you ended up with Mon Health.
Okay. Well, I went to undergrad at VCU in Richmond, Virginia. I'm from the Northern Virginia area. And then what brought me out to West Virginia is I went to medical school at WVSOM in Lewisburg to the osteopathic school. And then I came over to Mon General for residency with Cornerstone Care. And that's where I did my family medicine residency.
So what drew you to family medicine and primary care?
Well, I've always enjoyed treating the whole person, and that includes the family as well. So a lot of you can learn a lot about one person through who they're around, and also helping people improve their health in general.
I don't know how to ask this question without trying to ask like how old you are, but but do you get an opportunity to not just treat a patient, but to treat a family of patients, I guess is my question.
Yes.
Is that rewarding, and how does that benefit the patient?
That is rewarding, but you know what's going on in multiple different aspects of things, and you're able to treat them better that way.
I won't ask you how many generations of patients you've seen yet. How about that? We'll just leave that question out today.
Yeah.
Well, we want to get into primary care and the importance of having a primary care physician. So let's just start with that question straight up. Why is it important to have a primary care physician?
Well, for one, just the preventative care part of it. So doing your routine screenings, being able to improve your health so that you don't get to the point of needing to treat chronic illnesses or problems. The next thing is for chronic issues like hypertension, which is high blood pressure, high cholesterol, thyroid issues, those types of things, and we kind of keep it all together. So even if you're seeing multiple different specialties, we try to keep everything together in communication with them, and because a lot of times people will end up having a problem and they don't know where to go with it either, because it can hit so many different specialties and places, and many times we can just solve those issues in the general medicine area.
And also, if you have an emergency medical situation, you also have the role of coming in as the emergency doctor, maybe trying to figure it out. You're also there available, I would imagine, to go, okay, well, this patient has these certain things here, and it becomes does it become a team effort at that point to try to I'll say cure, but work on whatever emergency situation might be happening? Yes,
we definitely try to do that as well. So whenever we have to send patients to the emergency room or send people to the hospital, we try to stay in some communication with who's treating them there as well, to help them along further in what's been done already, and especially if it's not that new, but things that have been tried, and then if they have any questions, especially on their medications and their history, then we're able to communicate that with them.
I'm sure you've heard this many, many times before. Doc, I feel great. I don't need to come see you.
Yes.
Why do I? Okay, why is that a myth? Why do I need to even come, for the annual exam, the annual checkup, even if I'm feeling great?
Well, it really has to do with catching things before it becomes an issue. So many times people will have high blood pressure, but they don't feel it. It's not something you feel until it becomes until it gets super high, or it becomes a heart attack, or it turns into that. So we try to catch things before it becomes an issue and work on different treatments, medication-wise, but also lifestyle changes, too, to help them.
I use this comparison a lot on this show, and because it works for me, but I rotate the tires on my truck, I change the oil, I do a lot of preventative maintenance so I can make it last for a long time.
Exactly.
That's on my truck. Why wouldn't I do that with me? I don't know if it works or not, but it works in my brain, Doc.
Yeah. Yep, exactly. Just like that.
Dr. Gabrielle Sakellarides is our guest this morning, Mon Health Primary Care. We'll continue our conversation. Got to squeeze in a quick break. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Gabrielle Sakellarides is our guest this morning, Mon Health Primary Care. We're talking about, obviously, primary care today. And March is National Nutrition Month. So how important is having a healthy diet to our overall health?
Definitely extremely important. I get patients tell me all the time that they don't want to take a medicine because it has so many side effects, or they don't know how they're going to react to it. But just like medications, the food that we put in our body also has an effect, whether it's a good effect or a bad effect. We need a certain amount of vitamins and minerals. We need balanced diet to get everything that we do need to sustain ourselves. And then also too much of anything can be bad, like too much sugar can cause headaches, or I've had patients, we try to get to the root of why they're having diarrhea issues, and it might be dairy or it might be gluten, and it's not necessarily always something that we can test for. And so we kind of work together to figure out what's going on. Also, everyone is affected differently by what they eat, we find. And so we work on that and trying to figure out what foods help them or give them the most energy, but also the foods that are triggers for them in not making them feel good. Even things like depression and anxiety, it can make worse as well. So
I remember the old food pyramid when I was a kid, and that's been a while ago. Is it still applicable? And I think most people are familiar with it. Is it still applicable as a general guideline?
Yeah, I think the important thing is more well-balanced, lots of vegetables and fruit, and avoiding processed foods. I mean, processed foods are probably the worst thing to put in our bodies. Sodas are another thing that make things that are not very good, whether it's diet soda or not. And if you focus on getting the right amount of vegetables in, normally the proteins and the carbs kind of follow suit, like at the right amounts, if you can get the right amount of vegetables.
What do you often hear from patients when you're talking about eating healthier and having a better diet? I don't want to say excuses, but what are some excuses that you kind of gotta work around or get over to improving your diet?
Oh, I just don't like that type of food, or I can only drink soda. I don't like water. But a lot of it has to do with training yourself to do that. When you get used to something, especially when it's sugar is very addictive. There's ways to stop feeling like that's all you can drink and really get used to the other tastes. And so we try to work on that.
Yeah, we were speaking to a dietitian last week on the show, and she said people will often say, if it tastes bad, it must be healthy. Well, that doesn't have to be the case.
Exactly. It really doesn't have to be the case. It's one of the hardest things, I think, is the ease of things. So, processed types foods are very easy to grab, whereas foods that have more natural ingredients to them sometimes can take a little longer to make, but there's still ways around that too. That just requires a little bit of planning.
Yeah, that's what I was going to ask. What do you advise patients to do to try to overcome that? Because I'm as guilty of it as anybody, especially this time of year. On the run, on the road a lot. This is easy to grab. I can throw it in my lunch bucket and go. So how do you kind of overcome that trap of the processed foods being the easy food, the accessible food, and sticking to a healthy diet even when things are busy and you're on the go?
First off, everybody's a little bit different just depending on who they're feeding. Like, it's a lot sometimes harder, to be able to even feed one person when you're just cooking for one person, or then sometimes you're cooking for a whole family. So that plays a role in things too. But the buying and focusing on that vegetable portion of things. So getting used to some vegetables, having frozen things on hand so that you can just pop them in rather and avoiding the canned stuff. And when you get your food from the grocery store, doing prep work for that week so that everything is easily accessible. So if you like eating cucumbers or you like eating carrots, that type of thing, you would cut it up, have it washed already, ready to go. Same with fruit. Because if it's not ready when you're hungry, a lot of times you're going to go to the stuff that's easier to grab.
That's right. I'm hungry now. I don't want to spend an hour getting my food ready,
right.
Getting dinner ready. I want to eat now. I understand. Trust me. We're talking to Dr. Gabrielle Sakellarides. I thought I was going to get through that segment.
You got it.
I thought I was going to get through it. Mon Health Primary Care. When we return, we'll talk about some of the services offered on site as we continue our conversation on Mon Health Talk right here on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning, Dr. Gabrielle Sakellarides, Mon Health Primary Care. And what kind of offerings are available on site at Mon Health Primary?
So we have on-site lab, and we also do same-day appointments. So if there's something acute happening, like you're having sinus infection issues or sudden pain, then we're able to typically work you in most days. There's also a nurse practitioner that works at our office too, namely Andrea Jajikis, and so we kind of work together to help everybody as well. And the other thing that we offer at our core location that I do is the osteopathic manipulative therapy. So with my training, there's a big focus on the musculoskeletal system and how our body tries to heal itself, and that we use techniques to kind of help speed things up a little bit. And it's another modality to use in treating pain in general.
And you mentioned it briefly there, and I was going to bring it up next. You're actually located in Core?
Yes.
So you're out toward the western end, not far from Montague, or the middle of Montague County, the middle of Morgantown, but also very accessible to the western end of the county as well.
Yeah, we're down Route 7, and we're only about, I would say, like 10 minutes from the University Town Center.
Well, that's not too bad,
No.
10 minutes out that way. And, like I mentioned, a little bit more accessible out on that western end where I'm sure, I'm sure you've heard the excuse from patients before, well, I don't want to drive all the way to Morgantown. That's why I haven't been in for my checkup in, 2.5 decades.
Right, yeah. So we do a lot of that here, and then we have the labs here too, so we're able to get that done as well, trying to minimize as much traveling as possible.
So do you offer walk-in appointments, same-day appointments? Or?
Yeah, mostly same-day appointments. Mm-hmm. So usually calling in first, and then we can typically work you in the best spot.
What, generally speaking, are you able to see and treat in a same-day appointment?
Well, we've seen COVID. We do have on-site testing for COVID as well, same-day testing there. The nasal, or anything that can happen suddenly, anything that is new to the patient. So back pain would be a very common one. Somebody hurt themselves after they fell. And the nasal drainage, coughing, that type of thing.
And how can people reach you, find more information?
There's two ways. You can either contact us by phone, so it's 304-879-5020, or you can go to the website, monhealth.com. I guess it's at /core.
And we talked about primary care today. We talked a lot about healthy nutrition. But what do you want folks to really take away from our conversation today?
To make sure to at least get in to see your primary care doctor once a year, and to stay up to date on your wellness screenings. And a lot of times we're formulating those screenings based on your histories as well, your personal history and your family history. And to also get in to see more often when it comes to keeping up with chronic issues like blood pressures, cholesterol, thyroid, and so forth.
And it's been said time and time again here through many conversations on this program, it's so much easier to either A, prevent, or B, catch something very early on rather than the late stages. Then there are more treatment options available. Certainly it's much better to prevent something from happening than having to come back and treat it earlier. But you don't know, like you said earlier, you don't know that something's going on unless you're going in to get your annual checkup.
Exactly. I mean, I can't stress how important screenings are. We've definitely caught a lot of things due to patients' risk factors most of the time. Sometimes no risk factors at all and just regular screening, but we were able to catch cancers in particular very early on so that chemo and radiation weren't needed.
And that can be just through regular blood screenings as regular. They told them getting your numbers is what I hear that term a lot.
Blood screenings is one way, but then of course there's mammograms, pap smears, colonoscopies, or Cologuard testing, and with the blood work you would do like the prostate checks, and with the blood work, too, you're looking more, there's blood cancers and stuff like that can occur.
Hey, if I may use the truck analogy one more time, it's much easier to change the oil every couple of thousand miles than to, rebuild the headers. Much easier to do it that way, if you don't mind me using the terrible mechanic comparison again. Enjoyed the conversation this morning. Appreciate your time, and come back soon. Come back anytime, whenever you like. That's fine with me. Dr. Gabrielle Sakellarides, our guest this morning, Mon Health Primary Care in Core. Again, if you'd like more information, you can reach out at monhealth.com/core.